Thank you. Can you all hear me? Brilliant. It's an absolute pleasure to be here tonight. That was quite an introduction. I did find it very interesting, as someone said when we came in. This is meant to be the School of Computer Science, I think, and Mathematics. I've never seen so many technologists try and put a presentation on a screen and fail. So I thought that was a really good start to the evening. But it always happens when I present anything on digital. I don't know about you, if I'm the one in the room and the IT doesn't work in any shape or form, just because I have digital in the title, everybody assumes that I can work the projector. But anyway, I will move on. What I intend to do is try and talk a bit about the importance of digital transformation and data within the health and care sector, try and inspire some of you that are just starting on your careers why it's exciting and, in my view, the best place to do digital and data work and programmes and transformation, because you really are making a difference to the wider world, your communities and your family. Talk a bit about Welsh Government's priorities, and particularly NHS Wales, my role, how I ended up here, and hopefully then some time at the end for some question and answers. I particularly enjoy that part, so I do want to allow some time for at the end, because I want to hear your perspectives. The reason I do some of these events is very much to hear different people's views from different sectors, and I'm going to look at different age ranges and different communities. This is where I feel particularly old with some of you in the room, so here we go. So a bit about me and why I've ended up in Wales. And what is my role? So just for clarity, I'm the Chief Digital and Innovation Officer for NHS Wales, but I'm also part of Welsh Government. For those of you that it's a bit different in Wales compared to England. We don't have like a separate NHS England. Welsh Government and NHS Wales very much are one and the same, though we do have a variety of health boards as well as working with other health bodies. And one of those is an organisation called Digital Healthcare Wales. Many people go to me, how does your work or how do you relate to Digital Healthcare Wales? I think the easiest way to relate to my role, Digital Healthcare Wales, is I'm very much, if you like, the Commissioner of Digital Healthcare Wales, very much outlining what some of the national programmes are and what some of the asks are, and working with them to deliver many of those national programmes, as well as working with a variety of health boards and health bodies in other areas, as well as local government. I also have in this the moniker of being the Chief Digital Officer for Social Care. So I work very closely with local government as well, looking around social care information and data systems. And to top it all off, my other side of my world is around innovation, life sciences, and other technological gubbins, he says. Gubbins, that's a technical word, isn't it? But a lot of that includes things like genomics, looking at how we embed innovative practices within the health sector. So we're doing a lot of work in the virtual care and virtual ward space. What kind of technologies should we use for sensors, if you like, to collect vital signs and so forth, to look at different ways to deliver care. So I have a variety of hats. My background, I always think it's useful so you can see how I've ended up here. Wouldn't necessarily be a typical, you know, I didn't necessarily start what you say in IT or a service desk, but I did very much start in data. I was very much a data analyst, worked in business intelligence and information, using a variety of models, and for my sins, you know, I couldn't now, but all the sort of coding in the back end of Excel and access databases several years ago, all of that kind of stuff to analysis. But also done an awful lot in broader transformation work around pathways of care, as well as a lot of work in improving corporate governance in organisations. I've worked in health, social care, local government, the commercial sector and the NHS, so a real range. Now, the reason I say that is because I actually think, you know, sometimes having that broader perspective or talking to people with a broader perspective becomes really important, because that way you understand often what the user or the customer or the patient wants from life, or even other staff members. So one of the things I often talk about when we're designing or looking at different systems to put in, have you spoken to your clinicians? Have you spoken to your frontline staff? That's clinical, non-clinical. Do you understand the public and do you understand patients? If you don't do that, there's a variety, masses of sort of management studies that say you don't succeed in implementing your systems. It's one thing buying the technology, but if you're not buying the technology that solves the problem that you're trying to fix, you can just have a redundant white elephant on your hands. So one thing really keen, for me, having worked across the piece, I understand that service perspective as well. My actual responsibilities include obviously national policy and strategy, particularly on the NHS Wales side. I'll get onto that in due course around some of those priorities. We have various national funding pots. There's something, there's an innovation and investment fund for various national programmes, which I'll touch on. We're spending a lot of time looking at system-wide digital governance. The NHS in Wales is complex. We have 7 health boards, 3 or 4 other bodies, national bodies. We have Welsh Government. Sometimes it's one of my challenges is where are the decision points around how do we employ something nationally as opposed to something regionally. And that becomes a constant challenge in public services around, it's not as easy as when I've worked in the commercial sector that your board goes, get on, crack on, and you get on and it's not always that easy, but you often then can just deploy it because your board has said it, it's quite clear that that's what you've got to deliver. We often have a far greater range of stakeholders, which is sometimes the challenge, beyond just a single organisation. And on that, as I said, I'm the Welsh Government sponsor for Digital Healthcare Wales, very much sort of setting there, working with them to be clear around what are the asks from Welsh Government, around key electronic health record systems, big data repositories that we're trying to pull together, along with other organisations that I sponsor, like the Life Sciences Hub that many of you may have also heard about that we work with. And of course, I spend a lot of my time, as I did today, briefing ministers on a regular basis to talk about the challenges they face and some of the issues that we may face in the health service and in social care that are impacting on people's lives, and also the implementation. The last thing I'd probably link is I am the professional lead, if you like, for all digital health CDOs and CIOs in the health service. So I do regularly try and talk to each of the CDIOs and CIOs across the health boards. We've got to do a lot more in that space, but I'm very committed to trying to develop the profession. For my sins, I am a BCS fellow. I've got to remember that, but I thought that was important today. I only say that, it's not like say, hey, look at me. More the fact that why I believe it's so important to support the profession and try and sort of come to events like this, but also engage people. Because I think there is a risk when you work particularly in the health service. You hear a lot about the Chief Medical Officer profession, the CNIO. I think this is just as an important profession, the digital and IT profession. You know, if we can come together as a collective voice and try and influence national policy, I think that becomes really, really important. And by acting as a single profession, you can have influence on some of that thinking. So that's a bit of background for me, about me. So I will move on just quickly. I wanted to tell you, just to start off, why do I do what I do? So I always, when I'm doing one of these talks or similar, people say, what drives your passion? Why are you doing this? And I always go back. So I have my 17-year-old daughter. She's autistic. She has epilepsy and learning difficulties. All my life, I've got a folder this big of paper that I take everywhere. And I have to repeat it to clinical professionals, social care professionals. The time it takes for them to hear it for the 18th time, the time it takes for me to repeat it is incredibly frustrating. And we don't create, you know, that inclusive care package. We miss things. So about 2 years ago, for her epilepsy, she was prescribed some medicine from the local hospital. We took it home. And then we started to look at the ingredients. And in those ingredients was benzoates. Now, she also has something called oral granulitis, which is like oral cones. And if she has that, she just flares up. That was on her doctor's record, but not on her hospital's record. was only because we were observant and read, because we've got quite used to it. And that's actually just a minor thing. There are far more major risks out there because we're not joining up information. So when people say to me, why do you do this? It's because I think of my daughter, but I also think of other people out there that perhaps are not as savvy as me, perhaps don't understand things as well. And actually, we've got to get this right. It is about a duty of care, duty of quality, instilling this so people have safe care and those potential adverse episodes don't happen. On the other side, though, she's non-verbal. Technology is brilliant for her because she actually uses a talker, types everything in, and for her, she communicates with us in a far more comprehensive way than she ever would have without that technology before. Now, you know, many of you probably moan about your children or, you know, saying, oh, they're on the iPad, what are they watching this time? But because for her to learn, though, she watches all sorts of videos and reads all sorts of things. She's learnt so much more from technology in that reading because that's the way she learns than she would have at school. So it's also, so I talk about the duty of care, but it's also what are the opportunities technology brings beyond just the information around that quality of life that we can bring into the way we care about people and the way we support people long term. So I want to get that across. And then, so the diagram there is, you know, when we're designing a solution, you know, thinking through about that person at the centre, we use the term there, how do we join up that information? And there's a variety of things on this screen that you can get into about, you know, well, if you start to do that, how do you think about mobile working? How do you think about joining up that information? How can you do that monitoring? That's about wrapping that whole care package around the individual, the person. And that makes a huge difference if you hold that in your mind. I always say to people, if you ever doubt why you're doing it, I've had some very difficult meetings today with ministers, and I was beginning to question you know, why am I doing this? That is what I hold on to. I go, I know why I'm doing this, and the reason I've ended up at Welsh Government is because I've got frustrated with some of the policy nationally, and I thought, I'm going to try and influence this. I may regret it on certain days. This has been recorded, isn't it? But there are days. But it's important, I think, to hold on to that, why we're doing this. And if you hold on to that in the difficult days, I think that makes a huge difference. So, moving on, we are in a rapidly changing world, aren't we? You know all this, but, you know, in the health and care world, significant changes to demographics, huge percentage rise in people with long-term conditions, you know, an increasing elderly population. We're not going to be able to continue to provide the level of support and care in the current way we do it, the current care models. We just won't have the people, and we won't be able to continue to support the number of people in a way coming into our hospitals and even coming into GP practices. How do we think through we can care for people better at home and also think about stopping people getting to a point where they need higher levels of, I'm going to say, support before they ever need it? So is it around that vital signs monitoring, or is there other care packages? It could be technology to help them live more independently at home. In Wales as well, we've got significant health inequalities, and that is also something we need to think about around how can technology ensure there is consistent standards of practice. So by putting in particular systems and safeguards, or even sort of doing the right analysis, you can ensure there's greater consistency of how you undertake care by following standard processes and so forth. So all of those things that we need to respond to in this complex world. The health and care system is under pressure. We know that. There's financial issues, there's infrastructure issues, and you see often, you know, the pictures on the front of the page of the Daily Mail or whatever about the number of ambulances at the front door. So again, you mentioned the Darcy report. A lot of the messages in the Darcy report are very relevant for Wales. You know, we need to think about how can we deliver care in a different way at home. This has been the nirvana of everybody working in health and care for the last 20 to 25 years, if not longer. But I actually genuinely believe now that with the technology we've got, and the data we're starting to bring to bear, we can actually fulfil some of that ambition about helping to support people better at home. And I think that's really important. I think as well, a lot of the conversations have been around productivity. How do we use the resources we've got more efficiently? So I spent, a few weeks ago, it was probably a few months ago, I went to one of our health boards and I sat behind one of our ED consultants clerking a patient in. 45 minutes it took him to go to a paper record, open 5 different systems, go back to the paper record before he actually saw the patient. In other places I've worked, it's either 1 or 2 systems. And I'm going to name him because Tony's over there and is someone I've worked with recently, is one of our clinicians in the digital health space. And, you know, he sees this on a regular basis. You know, unfortunately, particularly in Wales, but it's also the same in England and Scotland and other parts, there are too many systems, or we've still got some over-reliance on paper. What I will tell you, as a way, Wales, unfortunately, is keeping the global fax industry of health alive. There are 1,000 fax machines, and I've said this publicly, in the Welsh Health Service, partly because we haven't landed electronic prescribing yet. That is 1,000 more fax machines, or even 1 more fax machine than I'd seen in the previous 10 years before I'd come to Wales. So that is a challenge. And it's not only the inefficiency that causes, but there are safety risks, because faxes come out with prescriptions and are more likely to get lost. So there's lots of safety issues there. So that is one of the challenges that we're trying to respond to, is the risks associated with, unfortunately, some sort of legacy infrastructure issues. I think as well, we can't escape the wider global landscape. You know, there are issues. So every day, for us, issues in Ukraine or wherever has an impact, and I'm sure it has an impact on all of you, about cost of infrastructure and devices and so forth. And that is a problem for us in Wales if we are going to invest in technology, because it is inflationary and we're having to deal with that with cost pressures. And then on top of that, of course, like anybody in this sector, but more broadly, is the threat of cyber attacks. And we've had, we know, without going into too much detail, they are increasing. And the health system is very vulnerable. So the impact, for example, you may have heard in London, there was a recent attack that affected pathology operations and the results coming out and the systems there. That really slowed down the rate in which people were getting their tests and were being seen. Ironically, many of the younger clinicians, when asked to revert to paper, didn't know how to. And that's how reliant we've come on technology. Now, someone did say to me, well, that wouldn't be a problem in Wales, would it? Because we would still be able to use paper. Now, there's that shouldn't be a badge of honour, but in some ways we've got that. But I think that global landscape is something increasingly that is worrying us. So often my colleagues talk to me, oh, well, capital investment in the roof of the building. That's really important. Yes, of course, if you're in an intensive care unit and your roof falls in, that's the here and now, isn't it? And you've got to solve it, and it's a real issue. So we all focus on that. But as I say, well, actually, but a cyber attack or a cyber instance is more likely to hit the whole of Wales or have a larger impact, but we don't necessarily see it as an immediate investment. It's always something we put off. If we had a cyber instance tomorrow, a really significant one, that would cause huge issues up and down in the land in Wales, which could have a greater impact on how we care and support people than perhaps a leaky roof. But that obviously is something that I have often a big debate with my estates colleagues about, but something we're challenged. And then probably just talk about, though, the opportunities, though. And I started to touch on that. I think it's really exciting at the moment. So, of course, we talk about things like genomics, robotics and drones. And we can get a little bit carried away at times. And you need to think through a little bit about what the problems we're trying to solve. What is the problem? Will these solutions work? However, it is here and now. So a few years ago, everybody laughed at me when I suggested we could use drones to ferry blood results or ferry organs for organ transplants across busy cities. I was in another system. They said, that's never going to happen. It's happening in San Francisco. It's happening in China on a regular basis. There are already being drones being used to ferry drugs. whether it's more of the gimmick or not, is seriously making a difference to the people. And robotics could be used, you know, there are many a hospital now using robotics to help with drugs dispensary. That's happening. It's here, and we can learn from it. AI, well, we all get excited. What do we mean by AI? How's it been? I think it's important to think through, the great thing about AI, particularly when it comes to big data sets, is how it can save days, hours, if not weeks and months around analysing huge data sets, particularly in the areas of genomics and DNA and all that. So Genomics Partnership Wales in the north of Cardiff is potentially one of our crown jewels. I don't know how much you know, but if you ever get the opportunity to go up to the new centre up there, it's really exciting. Big supercomputers. I nearly knocked a fridge on one of these supercomputers once, which went down really badly. But it's something we've got the potential. If you're really into data science and some of those supercomputing, they're really thinking through how can they use the DNA sequencing up there to look at different things. And then we're getting into the areas of using that data to do what we call precision medicine, customised medicine and response. So all of this new stuff you're hearing around responses, cancer vaccines and so forth, is based on huge data models and so forth. They're pulling from different sources, and they can't do that without digital to put the systems in and the infrastructure that we need to put in, then the data repositories, and then it's starting to churn the information out. We use the AI, and we've suddenly got cancer vaccine. So those people involved with that, some of those on the digital front, the infrastructure, if you get involved with that, you will be directly saving lives. And I think that's really exciting, the potential there to get involved in that kind of thing. You couldn't do it in any other sector. And that's, again, why I think, I don't necessarily do this for the money, I do it for the love, because I really genuinely think we're at the cusp of something very exciting. And digital and data and innovation is the way we're going to modernise the NHS and health and care. But we have some big challenges in how we're going to do that in Wales. So if I just whiz through. So I just wanted to do this. Sometimes, so this is what I experience on a daily basis sometimes, and it is hard. And the reason I put this in, I don't know, is that everybody goes to me, digital is really important. We must do digital transformation. And then I go, well, we need to sit down and talk about a few key things, and then everybody runs away. Now, that's been a bit glib. But it's really important, I go back to my first point, around how do we, in designing solutions, make sure we keep people with us on the journey. And that goes back to what are the benefits and the outcomes we're trying to deliver with our change. And it's trying to tell that narrative so we keep people with us. Sometimes I say, I try and avoid the use of the word IT, digital, informatics, information, and I know I probably shouldn't say that in our room. We can keep that as our own little dirty secret, if you like, but try and describe it in what are the outcomes and benefits we're trying to achieve. That keeps people with you. So I've got this really stark one. Sometimes, we have cases, unfortunately, it's on public record from the coroner's report, the lack of sharing of information across clinical systems contribute directly to the loss of life. Now, that's a stark fact, but it doesn't half wake people up when you see, actually, I've seen a few more of those potentially in some parts of this part of the UK than other parts. We're letting our citizens down, and we need to think through how do we respond to that to actually save people's lives. And if you put it in the context of we're saving people's lives, I think that really does hit home. And I think that, again, inspires me in how we can do this. So, for me, when I talk about digital, I think it's not just about the technology. You know all this. It's about bringing people with you. It's about talking to your clinicians, your non-clinicians, your receptionists, talking to your patients, understanding, what is it that we want. It is about delivering that person-centred care and getting it. It's easy to say right place, right way, right time. The skill is then listening to people and actually then translating that, and that's where we come in, translating that. So what are the needs that we need to consider in the design of our systems, the design of how we analyse the data, the design of new technologies, new innovation. But we've listened to people, sat down, heard them and tried to respond to them. And sometimes we also have to be honest, because there are huge raised expectations around what we can and cannot deliver. And some of that in conversations, people hear and read about some very exciting things on the news and you say, well, perhaps we can't deliver that in the here and now because we've got to do some of the bread and butter stuff. And that's one of the challenges, of course. So with the greatest respect to some of my political colleagues and so forth, of course, they see and get excited, and they should. They need to stretch and push us. But sometimes we've got to sort of say, yeah, but we've got to get some of the foundations right. And that's the balancing act we've got to pull off in all of this. But how do we sell it? So again, I talked about, so why are we doing this? So I talked about the Regulation 28, poor information sharing and lack of digital systems. People die if we don't share the information properly. They're at risk. There are safeguarding issues. The OECD did a recent report and noted in some work they've done that those health systems that are less digitally mature are 1.9 less efficient, less productive, 20% less productive. Now, there's lots of ways you can measure that, and I've gone into the detail, lots of assumptions made of that, but there are similar studies that have been done. NHS England said those that had electronic health records were safer but particularly more efficient because people understood what we talk about electronic health records. It's the main system that you see in hospitals particularly that have all the patient details, and you think, well, that's obvious, isn't it? You should have that. But not everybody has a really comprehensive one that supports what we call clinicians in what we call their decision making around particular health conditions. Not everybody has systems that properly tracks a patient from the front door to the back door of a hospital. If you haven't got that, you're likely to be less efficient, and therefore we're not making the best use of what is increasingly very scarce resources. We also have some issues around, we're in a competitive market for staff in Wales, and what we get, particularly on the borders, and it's particularly up in North Wales we get, is people come across here and train, or we train them, and then they quickly go back across to a more digitally mature environment at some of those hospitals because they go, it's a better working environment. I can work with better systems. We've also got to support our staff to make sure that they get the right information at the right time, but also are not seeing that dreaded wheel of death. The number of digital strategies, I've done several now, and the number one thing that comes up every time I speak to staff is, can you just give me a laptop that works and Wi-Fi? Not a system, just when I'm working around, or a tablet that gives me that mobile work. That's stopping me to do my job. The amount of time I see that wheel of death, or I can't log in, or I try and put a presentation on for people to view, those kind of things, are the frustration for people. We talk about a lot in health about the quadruple aim. Now, the quadruple aim is, are we delivering things in an efficient way, in a safe way? Are we doing it cost-effective way? And, is it aimed to reduce inequalities, as well as supporting our staff? So I now talk about IT, it's more about intelligent transformation. I think that's a better acronym now than the old IT. Some of you may want to hold on to the IT or the informatics, but I think it's about intelligent transformation. If we use digital and data in the right way, we can make sure we're far more precise with the transformation and respond to people's requirements. So, busy slide, but I threw this in. I don't expect you to read all this. So, there is, again, I came across a study just to emphasise around, there is a strong correlation between safety and digital maturity. Now, I've kind of marked Wales there based on something called a HIMSS assessment. Now, HIMSS, for those of you, is an international digital maturity assessment, particularly in healthcare, on a scale from 0 to 7. Wales doesn't rate particularly highly. Sometimes there's a debate around how you score and how you calculate it, but using where we are and our GDP, you can see, unfortunately, we don't score very well. Now, having said that, there is some really good stuff we do. So you know, we've got a really committed workforce. Oh, lost my. Sorry. Really committed digital profession across health, really trying to come together to make a difference. We have got some systems, so we've got something that is used across all hospitals called the Welsh Clinical Portal, which draws from one data set. But it's very much just about displaying one data set. This all helps from the safety point of view. But there is a range of other things around far more sophisticated use of information, the infrastructure we should have in hospitals that we do need to think about some of those basics. So I put that in as as an example of me trying to explain to lots of people why this is important. So we often have, I'm biased, and of course when I talk to senior colleagues I go, well of course if you just invested in digital and data then the world would be solved. Now, you know, we all use something to try and win our arguments, but this is the kind of thing that I have to think about to really get down to the level of going, oh, wouldn't it be nice to just have some nice shiny devices? Of course, that's not going to work. What's the value of investing in new digital products to support safer care or support more efficient working? And that's a lot what the Darcy report, for those of you that talked about, is how do we move from what they described from an analogue world to a digital world around trying to sort of support how we modernise the health service. Someone said to me, what's beyond digital? I did say quantum, but I think we've got an awful long way before we get there at the moment, and we need to think about that. Right. So, as I said, we do this. It's not just about the IT nor replacement or solely hardware. It's about transforming the quality of our services. And you have to engage staff along that. You do hit bumpy roads. You know, we don't always succeed. Health is a really complex sector, and I know everybody goes, oh, you would say that, but it involves people and different professions who all have their own views, all, you know, have their own opinions about different models of care. You know, we've got some brilliant clinicians, and of course Tony is one of them, but, you know, very specialised officers in their topic area, which can lead to people sort of very narrow focus. Brilliant. I wouldn't, you know, certain people, I would definitely want that consultant or that surgeon to operate on my big toe. Would I want them to then tell me about my mental health and well-being? Probably not. You know, and again, because particularly in certain forums, we are very specialist. But that then presents some challenges around everybody's wants and needs when we're trying to design things from a user-focused perspective. So you need to think through the skill, in particularly the health sector, is going, well, you may want it, but do you need it? And there's a real distinction there in how we design things when we're doing these kind of things. But at the end of the day, you know, we are doing this to try and make a big difference to the people we work with. So I'm just going to move on. So, what is the strategy in Wales? So I've been in Wales for about 20 months. I came from an integrated care system in England, just on the border. So apologies, I am English, though I like to say rapidly, as everybody working in Wales does. Of course, my grandparents came from North Wales, so we all like to suddenly grab something, don't we? One of the things that attracted me was the philosophy of something called A Healthier Wales, because it's the right philosophy. It talks about how do we support people to stay well at home. You know, when people need help, how do we get it to them? And how do we ensure, you know, it's a person-centred approach to the care they receive? We want more services provided outside of hospitals and closer to home. And we want to take the pressure off our hospitals. These are all our objectives in A Healthier Wales. And then, of course, the fourth one, headline, was about better use of technology in medicines. Now, this was written 5 years ago, before COVID, and then COVID came along, changed our world. So we all got very excited about technology, and we went, this is our time, didn't we? And in many ways, it did briefly seem very exciting. But then I think we almost, you know, I'm afraid to say we've almost missed that open goal. We haven't quite grasped it. And I think we just need to revisit and make people remember what we're trying to achieve here. It wasn't just about the remote consultations, it was about trying to pull together the data and to think about that wider care model. And that's what a Healthier Wales is about you start from the point of view is what is your care model, which is this more person-centred care model, and then you think through how can technology help. And then that's about, going back to my circles at the start, we need the shared information. We need, potential more at-home monitoring of our condition. We need to be able to respond in a quicker way to people before they might get into a critical scenario. And that's what a Healthier Wales is about. And when you read it, you then say to everybody, how are you going to achieve that? And sometimes the reaction is, well, we'll just find more people to work in the community and we'll make everybody work harder. Well, one, where you're going to find those people from, and anyway, everybody's knackered anyway, and you know, the young people, you know, you don't like to work hard, do you, really? So, how to alienate half your audience. But, so, digital and data is really key, and that's underpinning the Healthier Wales. Now, we're refreshing some of the key actions to try and make sure we don't lose it, but we've all said very much that's the right things for us going forward, and we don't seem to change it. Now, we have also, and it's less, Welsh Government has a broader digital and data strategy and then a smaller one around digital health and care. It talks about the importance of a digital workforce. That's really key in the health sector. We you know, probably haven't got a comprehensive, at times, professional development programme. We do bits. We've got some masters in, courses and so forth, but probably need to do more, and there is something to take from England in this space. And a sister organisation at BCS, obviously FedIP, how do we work with them to develop the sector as well, becomes really important. But that's not just, that also includes clinical staff. We need people that sort of can straddle, you know, that clinical workforce, but also understand the informatics arena. Because I can't tell you if a particular pathway, clinical pathway, is it safe or is that the right way? I need that experience. And that's really important. How do you get that diversity of thought all round? I think we talk about a lot about digital economy. Very much want to work more with academic providers and care providers more round. Data and collaboration becomes something I've already talked about. That's front and centre. Digital infrastructure. So I go back, there is something about the basics. We have forgotten the basics, and actually that's not just in Wales, that's the rest of the UK, in parts of Europe. Everybody tends to get exciting about AI. So the big thing that happened at the moment, we all suddenly realised this year and next year, all the laptops we bought for everybody in COVID, we probably need to replace. There's a bit of a cliff edge. We all got very excited, everybody's got a laptop. Now we're going, hang on a minute, we've got to think about the replacement and the cost of that. And now, you know, how do we factor that in on the plan? We must do user-centred digital services, I've mentioned that, and digital inclusion. We all get, I think there's a risk that we think everybody's got to be included and everybody's got to be brought online. I think one of the things we've got to think through is, you know, for those that perhaps don't want to come on this journey, well, if we're including everybody else, that might free up some resources to work with those that perhaps are not as included, or, you know, can't afford it. So it's not just those that can't, you know, what I say, use technology. It's also some people can't afford. There's an awful lot out there of people that can't afford Wi-Fi and infrastructure. And I'd probably say, though, but there are opportunities. So there's an awful lot of rough sleepers that have a mobile phone. Well, that means they're better connected, potentially, to healthcare needs or information than they were previously. So sometimes we think those vulnerable groups potentially are more exposed, when actually technology again presents an opportunity in how we can support them for some of those wider issues. Just whiz through a few things because I want to get into a bit of question and answer. So what are some of my big ticket items? Well, I really think, you know, I'm far more excited by AI. I'm far more excited by drones. I'm sorry, I'm a little bit of a geek. I like to play, you know. I'll buy a drone from Amazon and play with it for a week and then put it in a drawer and then I might forget about it. But so all those sort of things. But we mustn't forget the basics. And it's really important because if you don't get the basics right, you don't give people the confidence to come with you on the journey. So, you know, you say, oh, look at this snazzy app. And they go, yeah, but I can't log on. Or I can't get the connection. So they're not going to come with you on the journey. That's a big thing. We've got a big thing in Wales now. We've done an awful lot of good stuff over the year about joining up some of the data set and all sorts. But the world's moved on. Something called electronic health records. We're in a very different place from where we were in the early 2000s. It's a far more mature sector out there, commercial providers. There are some good and there's some bad ones up there, but they can really support how we work. The big thing for us, though, and that's why I've put on this head-scratching diagram, we've done a lot of what I call building as we go. What we haven't done is good enterprise architecture now. So do we understand how all the various systems, the data layer, the application layer, the technical infrastructure, how are they all going to join up and where are we trying to get to? We've got to do some more work. And I think that's often, for a lot of organisations with a lot of legacy history, you often do get to a place and go, I've got to stand back and think through where I'm at on this, because the risk is you end up making poor investments or tactical investments. And in the NHS, we can't afford to do that. But at the same time, because everybody wants something yesterday, we're trying to do that at the same time, trying to modernise some of the systems we've got. We've got some other important things that we're focused on. So, of course, the Wales NHS app, so we've still got some more work to do. It's there, but we've got to add the capabilities and the functionalities and start to link it in. That does make a difference as long as you get the right things in there. So it's in beta, people can access it, but we're going to do some further development. That becomes a really big thing for us around the patient-centred care. And there is some ongoing work around electronic prescribing and medicines management within the hospital settings that we're catching up other parts of the UK, and we will have caught up in the next 12 to 18 months. And then we can then think through how we connect all these systems. So they are some of our key focus areas going forward. The other big thing is thinking through about our data assets. So we've got a really good, what we call trusted data environment at Swansea University called the SAIL Data Bank that can be used to do a lot of analysis and is used for a lot of research and clinical trials. But we're also trying to improve what we call data to help with day-to-day operational management, care data and management information. So working with Digital Healthcare Wales on something called the National Data Resource with the health boards, in which we can flow a lot more of the data nationally into a single place to be able to do that more real-time analysis and use that data many times in many different forums, but it's a single source of the truth. So I've mentioned the National Architecture, and it is critical. It's a key thing that Digital Healthcare Wales are doing for us. This is just a diagram. I think one of the challenges for Wales, just that we're battling with, because of where we are with some of the infrastructure, there is a little bit of a cliff that we're almost got to invest from a cost point of view in some of that infrastructure before we start to sweat, if you like, some of those capabilities around AI and so forth. Other nations perhaps have gone through that pain, and that's where you hear around some of the opportunities around, well, why haven't you used this AI model and so forth. So there is something for us is about where is that break-even point around if we could get the infrastructure right, then we can start to take advantage of some of those wider assets. So I'll just quickly move on. I just want to say, you know, there is some really good stuff that we're doing in Wales, and you know, again, very committed profession. The NHS app, we're learning from what worked and what didn't work in England, which is really important. We work very closely with England. We've got some really good examples of some Some of our clinical networks have done some really good developments around patients that have been rolled out nationally right across Wales. We do share data in one clinical portal. It needs to be modernised, but the fact that we had it and we've had it, you can go to any hospital and access the same system and the same record. I think that is a big thing. It's not necessarily the case in parts of England or Scotland. And we've got some good examples around the genomics sector as well. So really good stuff that we're trying to drive forward. I think what I would say in Wales, I often say the great thing about Wales, and this is where I think as digital professionals, one of the things we've got to think about, is the great thing about Wales is its relationships. Everybody supposedly can get in a room. Well, it's a blinking big room half the time, but we can, and that does make a difference. However, because everybody has worked with one another for the last 40-odd years, the number of times you turn over stones and discover that they fell out in 1969 and haven't spoken for 40 years is incredible. However, that being said, that's also a big opportunity to try and sort of bring people together and think through things. And I do say the advantage about getting everybody in a room is the power and the difference you can make around digital by bringing different viewpoints together and having a multidisciplinary team is what makes a difference. Never try and work on your own. Bring people together with different perspectives and different organisations. You will get a far better relationship. So we've got lots of relationships that I'm battling with on a daily basis. How do I, we've got Welsh Government and then we've got Digital Healthcare Wales, for example, local health boards, and then we've got, social care. It's how do we bring all those together? It's not easy, but it's fascinating, interesting, challenging, bloody frustrating at times, but all of those things are something that we're about. But it's again, the relationships are brilliant, but they also can be incredibly frustrating. And then building on just quickly the point at the start around the relationship with England, I think there has been already in the last 3 or 4 months a change in dynamic. We're already being asked on a regular basis to reach out to Westminster colleagues. I think Westminster colleagues in the Department of Health and NHS England are suddenly thinking, oh, hang on a minute, I've got to consult and involve people from Wales. And that wasn't the natural reaction. And I think in Wales, we'd often go, well, there's no point talking to Westminster because they never talk to us anyway. So I think we are seeing the stronger relationships. For example, we looked at the Darzi report and been asked, where are we in relation to some of those issues in the Darzi report? Broader conversation around, there's far more willingness to say, well, actually, 250,000 people, patients do go across England annually for care. Well, we all knew that, but we didn't necessarily talk about it so much. Now we're talking about it in a far more open way and go, what are the data standards? So there was last week a 4 nations CIO meeting where we started to discuss data standards, the International Patient Summary. How could England and Wales almost be the test bed in the UK for the International Patient Summary and the various data standards? Really good. But there was sort of reluctance to do that before. It's just changed the dynamic around some of the ways of working, which is really powerful. So I just wanted to say, why is the BCS important to the NHS and social care? Well, it helps us, those that have taken various qualifications. It gives us, I understand people's professional standards. There is some assurance that people have thought about certain qualities and how they're doing it. The advocacy and policy development, inputting into some of that work more broadly. We do need to connect better. It was serendipitous in some ways. You reached out. I thought, I haven't done that since I've arrived in Wales, really connect with the local BCS. We often, get excited and go off, we're going to talk to the national police. Actually, we've got to talk to the people on the ground, the local people on the ground. We forget that. It's very easy to go off to a national conference, but actually you're the ones got the connections of the people that we should be having those conversations with. You can support with the research and innovation agenda, as well as helping to nurture and attract talent. So, like here, trying to say to you, look, it is exciting. You can do your games, you can code your games or whatever. This makes a difference to people's lives. You are, my daughter, one of my daughters is uses an avatar that obviously someone's doing games to interact with people. And I know of people in the mental health environment. They're more comfortable interacting with avatar online than they are because that's the environment they worked in, and that helps their mental health. But it's a different way. But someone's taken their experience in gaming and started to apply it, that gamification, in the real world and in care services. And then, of course, there are ethical standards. One of the things we are talking a lot about, particularly the use of AI, is, and it's not as bad as it was, but do we understand how the data sets are being used to train the AI? And we all know, and we've played with ChatGPT, haven't we, that there is a risk that it draws from, shall we say, the particular bias from some aspects of the web more broadly that can have some abhorrent views around some of the things in the world. So we need to understand what are the ethics we're going to apply to how we train some of those models. So just to finish off, so I used, and then work out. So I used the term intelligent transformation. There are two Japanese words that I quite like as well. One's can-do, which is about the emotional connection. Do you have an emotional connection to the change you're trying to make? And for me, I hope I got across that I do. I mean, it was interesting. I went round Sony, and they use it as well as that. They use it as a word around it's about innovation and challenge, and I think that's really important. Constantly thinking, how do we challenge? Is this the way we do things? Is there a better way to do things? How will it deliver the better outcomes? And then the other thing, I talked about the infrastructure and I started to use it a bit more, is about mastering the basics or the fundamentals. And I think that's really important in digital health around the infrastructure, but also basic digital and data literacy. Can people use the basic devices? Can they use the data? So Kihon is about mastering the basics, the fundamentals. So for me, is if you hold on to those two sort of elements in the Japanese culture, I think they're quite nice to sort of finish with. So I'm going to end there. Sorry if I've gone a bit long, and welcome if we've got time for Q&A. I hope you got something for it, and I'd love to hear from you. Thank you. Yeah.
I don't mind going first if that's okay.
Yeah.
That was brilliant. I mean, having worked in NHS Wales myself in digital, so I recognise pretty much everything you presented on there in terms of the challenges. I'll pick up on one of your points and ask a question. I guess I've been pondering over the years.
Yeah.
Really is about obviously a lot of our systems in Wales are homegrown.
Yes. Yeah.
Electronic patient records, including upcoming UK companies, systems. So do you think Wales might look to more the private sector in terms of that sort of systems provision to give that one system for the clinician?
Yeah. So, I would be, it'd be unfair of me not to put it. There are differing views. Yeah. But what I will say is, I think 15, 20 years ago, it was the right thing to do. It wasn't a mature market. I think the market has moved on tremendously. And I think it would be naive of us to think that we could build clinical systems with the kind of inbuilt abilities around AI and technology, because even Microsoft and Google and the like struggle with that. We will not be able to do that. So whether it's completely buying off the shelf or working in partnership, that's what we've got to do, because that is the only way we'll keep up. And we are working now very closely with Digital Healthcare Wales and the health boards. Where do we go around the next steps of electronic health records? But what's really important, going back to the national architecture, if you understand what you've got and where you want to get to, then we can determine what we need. And that will determine what kind of system we may need. And without going into too much, you can have big monolithic American providers for some of you pros and cons to that, or you can think through actually these are the 3 or 4 capabilities that might plug the gaps. So there's a mix there, and it's a challenge because we've got some very good systems we're implementing, but we just need to know what our journey is over the next 10 years, and I think we're struggling a little bit on that. And that's at my door. I've got to work with health boards and digital to say how are we going to get from A to B. And the Cabinet Secretary this morning challenged me very hard on that, and I couldn't give him a very, quite the answer he wanted because we've still got an awful lot of work to do around that. Okay.
in this building. And I think you can't underestimate institutional knowledge. And
Okay.
I think when you've got people who are there, and like you said, you want to take in all these different perspectives, that institutional knowledge becomes very, very important. And then it becomes about investing in what you've actually got
Yeah.
access to. And sometimes it isn't about trying to take something off the shelf, because what happens then is you force your processes to fit a technology.
Yeah.
And there's been a lot of talk, and I know we talk quite a
Yeah.
lot about data, we've got these lovely data sets. What you haven't said is, actually, do we need them? Because if we don't understand our processes, if we don't understand our organisations as living organisms,
Yeah.
as these organic structures, if we don't understand that, then we don't necessarily understand the data we need. If we don't understand the data we need, we can't understand the systems we need. So sometimes it is about what's in the organisation, what have you got access to as an organisation, how do you build the talent within that so you retain that organisational knowledge and help them grow as an organic.
Yeah. So don't get me wrong about, I think it's off the shelf. What I'm saying is that I agree we've got to nurture the talent, but to exclude some of the really good work out there that's been done worldwide. So why is it 197 other health systems are working with commercial partners on EPRs and we're not? And I'm slightly exaggerating, but that is the tendency. But there are partners out there that will, or commercial partners, will want to work with us to develop something in the ilk that you describe. What I'm worried about is that, and we need to find a balance, what I'm worried about is we've got a pressing need to move very swiftly compared to an awful lot of other health systems out there. And I don't want Wales to be behind the curve. So it could be, it might not be either or, and this is what we're going to is, well, maybe we need to do something a little bit off the shelf, but with a view to developing something that's more bespoke. But we need to just weigh that up around the decision. What I would say, in deploying any